Hey, this is Edwin Dearborn. If you're in the dental field and you're looking to build not only team loyalty internally, but client loyalty, getting those valuable clients, those patients to come back to you and get even more treatment and refer, I brought with us today an expert, Lisa Copeland.
Hi.
Hey, Lisa, sorry about that. But, I'm so excited about you coming here, Lisa, and joining us here on Growth Driven.
Thanks for having me. I'm excited to just have this conversation. I think it's really important for us to do.
I absolutely agree. We'd spoken earlier before the show, and I was telling you how I'm looking to work with more dentists, and it's kind of the reasons why we connected and networked. Kind of tell me your story of how you got started working in the dental field and helping to build teams within that industry.
Yeah. Well, I'm a dental hygienist of 30 years.
Wow.
And I've always partnered being a dental hygienist clinically with, I've always been a corporate speaker as well. I was a corporate speaker for over 30 years and decided to take those two experiences and launch my own business, really focusing on dental team and dental patient communication. Mm-hmm. And so those two worlds collided really well.
That's awesome. And I'm sure that there's even somebody's watching this and they're not necessarily in the dental field. Mm-hmm. I'm sure there's a lot of takeaways that they can learn that are, universal, if you will, to any type of practice or business.
Absolutely. Because communication is the foundation of business. I speak to mostly dental professionals and healthcare professionals, but I also do corporate team training as well, because you've got to get the communication right. And one of the things that I do that I really emphasize during team trainings is communication amongst the generations, because we're really having a friction problem with that. And so everything that we talk about has a generational perspective to it, so that we can better communicate with each generation we're working with, as well as each generation that we're treating as patients.
Makes a lot of sense. I mean, each generation has its own ethos, its own even nomenclature and language, beliefs, right? So how you would talk to a baby boomer, since I'm a baby boomer, would be different than, let's say, my daughter who's a millennial.
Absolutely. And it should be. If you're cookie cutting your conversations and doing the same thing for everybody, you're not going to get great results. You'll get it with one category, but you could be getting it with every category. So it's so important for you to customize your generational language.
Yeah. So I think what you've done very intelligently and very astutely in your observation is there's no patient audience. We've got different layers of people that they walk in, and you've got to be able to identify, okay, this is the way I speak to this audience to really get an understanding going.
Right. And a great example of that is if you're a dental professional and you're delivering a treatment case or a treatment plan to a patient, looking at their generational age is going to help you deliver that with more success. And so I'll give you an example just to kind of break down. If you're talking to a traditionalist, traditionalist is our oldest generation still living. They're the first cohort that we really studied. And so if you're working with a traditionalist, they are very provider recommendation based. They want the provider to tell them what they need to do, but they have to trust that person first, and they have to know that they're loyal to their needs. And so that's the way that you want to deliver that conversation. With a baby boomer, don't ever rush a conversation with a baby boomer. They want to build a relationship with you first. They want to know all the details about the treatment. They want a very intense conversation, and they don't want interruptions during that conversation. They also want the Is it?
That's so
good. Yeah. See? And these are their guidelines, because not everybody falls into these categories perfectly. But, with a baby boomer, they want to know that they can call you with questions directly once they leave the office, but you don't want to ever rush that appointment, because that will make them not want to do that treatment. For a Gen X, I'm a Gen X,
Okay.
and I'm born on the last year of the baby boomers, and so I'm what's known as a cusper. And so cuspers have a nice advantage because I've got one foot in baby boomers and one very, very solid foot in Gen X. And so they are very linear people. They like things laid out. Here are your options. This is option A. This is the best. This is what I would do if it was my mouth. This is option B. This is still a good option. And here are different ways that you can pay. We have payment opportunities for you. They want to know everything in a linear process. And they also want to know how to schedule the appointments so they can break things up as far as payments and time. And so that's the best way to approach a Gen X is very linear thinking. Millennials are very, very me oriented, meaning they want to know what's in it for them. What is that treatment plan going to do for them? They don't like interruptions while they're being worked on or while they're in the dental chair. So in every dental office, you have the administrative assistant that has to come back and ask the doctor a question. Probably a good idea to wait if they're working with a millennial, or they're also known as Gen Y. And then our Gen Zs, they're the patients that are just coming into our practice as adults, and they're also our new employees. Right? They're just coming into the workforce. They're in their mid-20s. And so Gen Zs are very preventive oriented. They want to know if they do this process now, is it going to prevent further spending of money later? And is it going to prevent me from needing more care at a later date? So they're great patients as far as delivering a treatment case and getting case acceptance, because they're all about prevention and very, very thrifty.
Very interesting. I'm sure this is kind of a shock to the doctors and dentists and teams that you talk to, but as you're telling them, they probably go, yeah, that is how they are.
Mm-hmm. They do. And of course they do exactly what you did. Oh my gosh, that's so me. That is so me. And when I describe the Gen Z or the Gen X, that is so me. I want it laid out in linear, put it in an Excel spreadsheet if you'd like, right?
Yeah.
And so people first relate to themselves, and then they relate whatever they're hearing from their perspective first. And so, yeah, every office is like, oh, that's her. Oh, that's him.
Yeah, and I think it's good to really understand that, because, what's that saying? Good bedside manner is part of the healing process, and if you're able to relate and communicate effectively, I think that's an important part of the recovery or the treatment process, so the person's actually in the right mindset, the right comfort level to do the treatment that you're recommending.
Exactly. They have to know that you're on their side. And gone are the days when we were production centric. We have to be patient centric now in order to maintain our existing patients, to attract new patients, and to gain loyalty. Because if people don't trust you and they don't think that you have their best interest at heart, they're not going to stay in our practices.
Absolutely. I was talking, before this, I was talking about the gentleman that I knew, Dr. David Cutts, and he has a saying, which is the patient already knows. Meaning when they walk in, they already have a perception of whether you care or not.
Oh, yes.
Whether you really have their best interest. And if you're just trying to be production centric and get as much money from them as possible without really caring about their needs, he says they're going to pick it up and they're going to leave.
Oh, absolutely. He's right on. And he's way ahead of a lot of dental offices in realizing that those relationships are what build the foundation of your business. And it's always been that way, but even more so now with the younger generations. So he is a brilliant man.
I'll let him know. I'll pass this video on to him.
Oh, perfect.
He'll love to hear that. So you walk into an office. What is usually the pain point? Like, an office is bringing you in, what are they looking at as their problem? Obviously, you concentrate their attention on caring for the patient and listening to the patient, but how do they usually perceive their problem in the beginning?
So they think it's the patient's problem.
Of course.
Honestly, that's the bottom line is they think this patient they're not getting how much they need this process or this procedure or this treatment. They don't understand that they have an abscess, even though they can't feel it. Right. And so it's very interesting to change that dynamic of, is it the way that they're delivering the message to the patient? Right. And is it the way that the staff is interacting with that particular patient? If the administrative assistant gives an answer to a question that the patient asked in the back that is different than what they got in the clinical area, their trust is gone. Right. That treatment plan is not going to happen. And so again, it comes back to communication. Processes and protocols and procedures, they all everybody's got to be on the same page. Everybody's got to be giving the same answer to the same question and delivering the message the same way, because you're going to lose patient trust really quickly. And we all know how long it takes for us to build trust with people. And Absolutely. It can be broken in a heartbeat, right?
In a heartbeat. Hey, if you're just joining in, I'm with Lisa Copeland, and she is with communicatewithinfluence.org. And Lisa's sharing with us some great insight. So if you're listening to this on a podcast, I not only do I video this, but I'm going to upload as a podcast on various channels. You can find Lisa Copeland at communicatewithinfluence.org. And she's sharing with us some great insight about audience types and overcoming this internal barrier that you think it's the patient's problem for not understanding, when really the problem is we haven't adapted our systems and processes to identify the right audiences and then how to communicate with them, thus building trust.
Mm-hmm. The other part that plays into that, and this is something that none of us really learn in school, no matter what you go to, what kind of school you go to, is actively listening. Asking the right questions, right? Formulating your questions so that you get the answer, rather than just asking those yes and no, open-ended versus closed-ended questions. And so if I ask a patient an open-ended question, meaning, what would you like to improve about your smile? That's a great question to find out what's important to the patient about their smile. And they're going to tell you, they want whiter teeth, they want straighter teeth, they want fresher breath. They just launch into so much information that you can actually use when you go to treatment plan for that patient. So if they've said right up front that they're really they're really interested and want better aesthetics with their teeth, then that's something you're going to offer them when you combine it with the treatment. Right? It opens up the door for you to have a much more productive day with that patient. You're going to increase your production just by really just marrying the treatment that they need with the aesthetics that they want. And so active listening comes into play, and asking those open-ended questions is huge.
Yeah, totally agree. It's funny you talk about this. I was just about to say mirroring, because I'm a big fan of Chris Voss, Never Split the Difference.
Oh, yes.
I don't know if I've watched a few of his videos. I've read his book, Never Split the Difference. Then I got the book on audio, and I would listen to it when I was traveling to California from Las Vegas. And it was, what you're saying is so accurate. I don't think that dental offices have really adapted this new way of how, it's like everything's a negotiation, really.
Mm-hmm.
So you're teaching dentists going, hey, look, if you can learn this new way of communicating, identify your audience, what's important to them, and do what you're saying, actively listen, you're going to be so much more relatable, which then increases trust.
Mm-hmm.
And then trust equals more clients and more patients.
Right. And production.
Absolutely. So I think everybody wants the same thing, more production. It's just, we have new methodologies, and we have to come to a new understanding of how the world works.
Right. And dentistry has changed from a patient perspective. And that's what's driving dentistry right now, is the patients are much more involved in the choices that they have.
Oh, yeah.
And dentistry has become highly competitive. And so if you're not adjusting, you're going to be left behind. You're not going to have new patients coming in, and you're going to have them going out the back door. And so it's so important for patients, or for, the practice owners and the teams to work more cohesively. And that, I think that's something that became very, very evident during COVID, is team communication, and how poorly all of the team was communicating with each other when the dental offices closed. And, I had people calling me saying, my dentist closed the office in March and we have not heard from them since. And now they're telling us we're going to reopen in 2 months or in 2 weeks. And we haven't even talked about what we need to do as an office to keep the staff safe, let alone the patients safe. And they're just in tears. And so I think that communication gap was really exposed during COVID. And now everybody is thinking, oh my gosh, we've got to learn how to communicate better. And so it's come to the forefront, which I'm really happy to see.
Yeah, you got me thinking here. It's interesting that, during times of danger, I think there's 2 responses people have in general.
Mm-hmm.
The first response is to pull back and wait and kind of hunker down, which I think 90 to 95% of the people do. And then the other 5 or 10% go, I've got to do more. I've got to reach more. And I think the practices and the businesses that responded and changed and adapted and aggressively went out, not to say they didn't have hard times, but they're going to come out of this COVID thing a lot bigger, because they did all that communicating.
Right.
When everybody else was withdrawing and hunkering down.
Yeah. And that's such natural human behavior.
Mm-hmm.
Just I'm going to just sit and wait and see what other people do. And then I'm going to follow. Mm-hmm. And the practices that were above that curve, or ahead of the curve, I guess we should say, are really doing well. And they did really well through COVID because they adapted, they followed principles of resilience, and they really adapted to be able to move forward, right? So they adapted technology. They started using text messages. They started using more software features of the systems that they already had, because so many, and this isn't just in dentistry, so many people have a software program and they only use 10% of it. And there's all these other beautiful features. Yeah. Yeah. And so they went back to the companies and said, hey, we need to show us how to really maximize this communication system. And they were off and running. And, other dentists had that same system, but they didn't go back and utilize the features. And so there's a big gap for sure.
Yeah. It's almost like, you do your own marketing, but I think it's almost like, how to boom as a post-COVID practice.
Yeah.
It's like, to me, that'd be like, hey, I was telling a lot of my clients, I said, you don't know how much the world changed over this last year. And it's going to hit you when we come out of this and we start getting into business together, and you're going to have an audience that's going to have a whole new set of questions, a whole new set of requirements, a whole new set of expectations. And if you don't delve into that and find out what the heck all those questions and needs and desires and protocols are, right, you're going to fall, like you said, you're going to fall behind to the practice or business that did figure it out.
Yeah, exactly. And the other thing is, trying to sit down together as a company and figure out what are those questions people are going to be asking now. Let's give them the answers before they have to ask those questions. And if you can come up with, we're not going to come up with everything, because there's always going to be somebody that throws you, that curveball. But if you can come up with 5, 6, 7 directions that you think the patients are going to go as far as their questions, and preempt it, put the information on your social media posts, right? And make the patients feel safe, make them know you've made changes for them to come into your office. And here's what we've done to keep you safe and to keep our team safe, and post it everywhere so that the patient sees it and they're aware that you're changing to accommodate them and really to accommodate the changes the world's seen over the last, year and a half now, right? That's unbelievable.
It is unbelievable. I was talking to another consultant like yourself that talks to dentists, and he said the other thing, to your point here, is you're going to have to really be a practice that inspires positivity. There's so much negativity and division, whether it's political or just the news or fear of this or fear of that. He says the other way that we've really got to promote and, to your point, communicate in this new era is that we're a source of positivity. And I think people are going to be drawn to brands that have a high sense of positivity during moments of weakness,
right,
or fear.
Absolutely. And I that's funny that you mentioned that. I just out of COVID, I wrote a course for dental professionals called Emotional Safety. And it's really looking at how do you create a safe environment for your employees as well as your patients. Not emotional wellness, that's a completely different topic, but it's emotional safety, meaning does everybody feel heard? Do they feel comfortable in, talking about whatever issues the office is having? Do they feel like there's open communication? Is everybody included? It's going off in a whole new direction that the dentistry is not familiar with for the most part. That I think is a really needed topic right now because people don't know what to do. They just are trying to pull pieces together from here and here and here.
Yeah. And, there's a lot of dentists that are individuals that are kind of fighting this change towards corporate dentistry. They complain about it all the time. But if they were to do what you're saying, and corporate dentistry was slow to adapt to this new world, I'm sure corporate dentistry is going to have to adapt quickly. They'll see it in their numbers. But this could be the competitive edge is, hey, I'm creating a positive environment for my team. That's that could be probably one of their unique selling points to work for them and to come as a patient.
Right. And I think that's a selling point no matter what kind of practice you're in, whether it's an individual practice or a large group practice or a DSO, the corporate practices. I think everyone is looking at that topic and trying to visualize and implement what can we do to make this attractive for both the team members that we're going to be hiring and the patients to be coming into the practice.
Great. And then now that we're getting back into the, people are starting to take off their masks, we're starting to go back, back out. On June 1st here in Nevada, I live in Las Vegas. June 1st, we go to 100% capacity.
Oh, nice.
And we're going to be having events and concerts and, we're going back to normal in terms of being able to entertain, which is what Vegas is famous for. Do you see yourself rapidly going back into live events, or tell me how COVID's changed you and how you're communicating and reaching your audience?
So live events are definitely starting to get scheduled. I'm booking now into later in the year for this year and into 2022 for sure live. But I don't think virtual is going to go away. I think that just in general, people have realized how valuable and effective virtual training can be. And so I think there's still going to be a place for it, which is, from a travel perspective for me, I love traveling. I love going to live events. I love the interaction. But also, doing a virtual team training is so cost effective for the companies. You do one live and then you follow up with 4, deep dives virtually. Rather than just always being in person. So I don't think it's going away. And I think people have embraced it, whereas if COVID had never happened, people were very, very resistant to virtual training. And now it's just life, it's sticking around for sure.
Yeah. I think there's 2 things are going to come out of it. Like you said, there's going to be a hybrid. Kind of like, well, can we do this virtually and get away with it? And let's do it virtually. Now we don't have to fly a bunch of people out. But I also think there's going to be a revival, a brand new excitement for live events.
Oh, for sure.
We missed it. And now it's kind of like, it's almost nostalgic now. Let's go out and, let's go out and go to a live event. It's going to be fun.
I totally agree. I have my first live event in June, the middle of June. I actually have 3 back to back, and then also in July. And I'm so excited, I can't tell you. And I know the people that are attending, but they are still doing virtual meeting as well, because some people just aren't ready for it. They just either they've chosen to not be vaccinated, or they're just not ready to be in those crowds yet. And I think it's wonderful that they're offering both. And for the companies that are hosting the meetings, it's brilliant because they're getting more money for participation than they would have if they just did the live event, right? It's an easy way for them to increase their revenue as well.
Absolutely. And I think, I call those type of people that will come out immediately, they're the first responders. And those first responders will then go back home and they'll prove to everybody that not everybody's dying.
Right.
And I think, within a year, I think all those people, whether they got vaccinated or not, will come out because they're just going to wait to see what happens. And okay, my friend's been going and nothing happened, so I guess it's safe.
Right. It's just like when the practices, closed down. It was some people went, cocooned and just waited to see what other people did. And the same thing's going to happen with people attending live events. But I love the opportunity to be able to be in a room with a group of people and then have a virtual audience at the same time. And that makes it interesting for speakers, as you know, right? Because you have to include the virtual audience while you're in front of the live audience. And so I like that dynamic. It's been very interesting to figure it out, but I do like the dynamic.
Yeah, it's almost like that, in the movies where they would have to turn around and they tell you their private thoughts to the camera.
Yes.
You're going to have to kind of look at, you got the audience, and then unless they have the cameras situated so you feel like part of the audience.
Right, exactly.
Yeah, that's interesting.
One of my colleagues, she did one earlier on when this hybrid thing was just starting to come about, and she actually ran from the ballroom she was speaking in down to the studio where the virtual attendees were, and she ran back and forth the hallway, which I thought was brilliant. It really provided a sense of inclusion.
Yeah, no, I like that. And I think people will come up with crazy innovative ways to do it.
Yeah.
And I think it's going to be great. I'm also seeing that even for small businesses that only want to reach 20 people, whereas, they go, okay, well, let's go rent, a hotel room or a restaurant to do our, those, financial planners would do those dinner presentations. And I think it'll be like, okay, how do we do the dinner presentations, but do it through a Zoom call? Obviously shorten it because we don't have to serve the food and all that other stuff. And I think you're right, there's going to be a hybrid. So tell me where the future, where you're going with your business and where you think you see big opportunities in helping dental practices in the future.
So my wish is to really level up the communication skills of private practices and corporate teams. And so working individually with the private practices so that I can really customize, here's where I see the struggles in your practice and the challenges, and here's what you're doing really, really well. So let's keep this and add this. And then with the corporate training, I love just working with either salespeople, marketing, any of the departments who are interacting with customers, and really teaching them how to customize their generational language so that they get the sale, right? They sell the product and their company is attracting new team members as well as new clients. And so that's my passions, is to really help those aspects of dentistry and corporate grow in their communication skills.
I think that's going to be very popular with corporate, because if you can say, I'm going to work with your sales teams to adapt your communication to get more closes and higher cases. I mean, what's the downfall?
Yeah, exactly.
Right? Exactly. Great. Well, I'll tell you, Lisa, I've learned so much, and I really enjoy the fact that you've been here, because I think in a new unit of time, I really appreciate, like, we talk about millennials and baby boomers and their differences, but the fact that you've actually built a process in place to elevate a practice, to actually leverage the data, to actually serve the client better. I love the fact that you've put that into protocols and really bringing people's awareness. And I think the other thing is that, we are going to this hybrid. I'm glad that you're getting back on the road. I'm hoping to get back on the road here soon and speak to,
Yeah.
the conferences you're at or whatever conferences they are. I'm really looking forward to meeting people as well and to see where that hybrid is going to go for business.
Yeah, absolutely. And thank you. Thank you for the compliment. I really appreciate that. And I love our conversation that we had. I'm looking forward to continuing it.
Yeah. So any last words before we've been here for about 30 minutes. I usually run it for about 30 or 40 minutes. So anything you'd like to say, or maybe we didn't touch upon that you'd like to accentuate?
No, I think really just reiterate what we talked about. Practice your active listening. Please connect with me. I'm totally open to really just having conversations with you. If you're interested in learning more about the generations, you can connect with me on my my website, which is on the bottom there.
Yep.
Or connect with me on LinkedIn, on social media, your social media choice.
Yeah.
My preference, because I am a Gen Xer, my preference of communication is texting.
Okay.
And so that's the best way to reach me.
Awesome. So then you get your contact information and your LinkedIn profile, Lisa Copeland, or we have the website down here that's scrolling. And if you're on a podcast and you can't see it, it's communicatewithinfluence.org. Well, I really, really appreciate you being here. Maybe, a year from now when we're back on the road, love to get back on and kind of see where the dental market has changed and what's been the same and how we're evolving.
I would love that. It'd be my
That's
pleasure.
All right. Well, guys, thanks for joining us here on Growth Driven. We always try to bring to you exciting guests that bring insight, information, actionable strategies. And today, Lisa Copeland has done so well on all front of them. And I'm so glad that you were here. And we look forward to seeing you again, once again, on Growth Driven.